Alta Summit Medical Center in Oakland and Berkeley is part of Sutter Health, a nonprofit healthcare system in Northern California. Sutter Health hospitals care for more than 3 million people and for more low-income patients in Northern California than anyone else. The medical center is located in one of the most diverse areas in America in terms of economic status, education, and race. In 2012, the medical center played a key role in convening the Community Integrated Healthcare Partnership.
The initial impetus for the partnership was to improve the flow of patients through the emergency department, as well as to improve care transitions. We had much success with these programs, and we saw a significant decrease in emergency department length of stay. We then saw that many of our complex care patients were getting readmitted far too often to the hospital. So we expanded our programs to include inpatients, and through our programs we were able to see a 25% reduction in the readmission rate.
Many of these patients are both inpatient and ED high utilizers. And it really gave us perspective on what's happening in the community, the resources that are out there, and how disintegrated care was.
The partnership consists of clinics, our public hospital, county health system, homeless and housing agencies, mental health agencies, payers, and our county EMS. Our greatest teachers are our patients, particularly those with high utilization.
I think they all should have that communication, regardless of what hospital you're from, regardless of what insurance company you're from, I think everybody should coordinate.
We're really breaking down those silos. It involves a lot of relationship building. On a daily basis, we're talking to the discharge planners and the social workers at the hospital.
By talking to these community clinics that we barely knew the phone numbers to before, let alone had the correct address. But now our case managers are talking to their case managers. Our doctors can send message electronically to them.
Our tools to manage patients and communicate with our partners include a data sharing tool. Social workers and nurse case managers staff our emergency department 7 days a week. We develop our shared care plans with our partners for our patients with high utilization.
And you can also ask the pharmacist if you have...
You feel like you're supported once you discharge these patients because there's a clear handoff to someone who's really going to pick up that patient.
Partnership programs also include clinic care transition nurses, urgent care, a new clinic for high-risk patients, our health equity project, chronic disease resources, and closer collaboration with mental health, substance use, and housing agencies. Many of our programs are funded through community benefit and philanthropy.
Our role is to provide situational awareness to our partner hospitals about the high utilizers of the 911 system.
We coordinate care around some of the homeless patients that have been using the emergency room for their medical services. The system of notification is critical for us to be aware that they've used the emergency room.
The partnership has had a significant impact on our patients, our partners, and our medical center.
I feel better as a doctor knowing we have all of these important relationships.
We're now all talking to one another, and how we develop those lines of communication was the key, and I think it's the key to anyone else who's trying to replicate some of this.